Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between.
Morning, George. It's Tuesday morning, and I am covering Dr. Brian McKirkin's practice as he vacations in Aruba, one of our members on Peds Unite listserv.
Yes. Today we have a dear friend, Dr. Igor Trojan.
Trogan.
Oh, Trogan.
Yes.
I've been calling it wrong.
Yeah, we won't go there.
That's pretty silly. All right. The topic of discussion today is going to be good technology that enhances good quality medicine, maximizes profits, and prevents physician burnout. Take it away.
Dr. Trogan is a physician executive leader who uses technology to improve outcomes, maximize efficiency, and prevent burnout among clinical staff. Welcome back, Igor. It's a pleasure to see you.
Good morning, Herb and George. Pleasure to see you as well and be participating in this webinar.
And second time around for you, huh?
Yes, I enjoyed it so much, I decided to come back.
All right.
How are things going on your end of the woods?
Good, staying busy with the winter season, but we are well positioned to meet all the challenges that this winter is going to throw at us.
Great. Now, you're a big user of technology, and that's part of why we wanted to see you again. This episode is going to be about the key technology solutions that practice needs to stay in business.
And some of the products that we're going to discuss, I have no financial relationship with them. Basically, these are the products or companies that are found to be useful. There might be other companies or products that are better, but what I wanted for people to get out of this webinar is some actionable points or tasks that they can do and implement in their practice to make their life a little bit easier as owners or managers of pediatric practices.
Great. Now, you're big into using technology for security in your practices.
Correct. We found early on that it's very important for us to know what's happening in the offices. We wanted to make sure that the staff were doing what they're supposed to, answering phone calls, not on their cell phone. We wanted to be able to look at security footage if there were any incidents in the office. For example, if you had a rowdy patient. We also wanted to know what was happening outside our office. For example, on a snow day, is our parking lot clean or not? Do we have a delayed opening, or the parking lot is spotless and we can start seeing patients? Having security cameras in the office was very important to us. Also, we have 10 office locations as well, too. So it was important for us to have an integrated system where we could look at all the security footages or all the cameras of all the office locations and see what's going on. And one of the companies that we basically utilize is Ring Alarm and their cameras. So what I like about the Ring security system is that their cameras, which about 200 to 50, are very durable, both indoors and outdoors. Many of them have night vision as well, too. You can use them wirelessly, but if you use them wirelessly, you need to have an external power source. We like to use power over Ethernet. So you can just connect a Cat5 or Cat6 cable to them, attach them, and that supplies not only the power, but also gives them the internet and the ability to record everything that you need to. So very easy to install. And by going with Ring, also they give you lifetime warranty on all the cameras and all the alarm equipment that you have. Very economical. Monitoring is only $100 a year, $120 a year. It's very cheap compared to some of the monitoring fees that some of the major players like ADT will charge. And also the nice thing about the Ring security feature is that you're able to integrate certain electronic door locks together with the Ring system. So that gives you the ability to check to see if the doors are open or closed. It also gives you the ability to give each employee the individual PIN code. So we don't have employees have any keys. They all have their own 4-digit PIN that they use to open and close the office and also to enable and disable the alarm system. So when an employee leaves, all you have to do is go to the app, delete the employee, and that's it. They don't have access to your office anymore, which makes it very easy as opposed to constantly keep getting a locksmith to keep changing the door locks every time somebody leaves.
I thought the Ring cameras were like one unit that you put at your front door to check for Amazon packages. It sounds like it's more than that.
Oh, yes. We have cameras in the waiting room. We have them in the reception area, in the hallways, in the utility room. Basically, any common area is being monitored to make sure that if there are any incidents, we can go back to the footage. You can have a trip or fall. We once able to catch an employee who was stealing supplies. Just last week, we had an incident where mom said, I paid $200 in $100 bills, yet only a $100 bill was present at the closing envelope. We were able to pull up the security footage and see that mom did indeed pay the correct amount. It's a very useful feature to have.
I have a couple of questions. One, you said $100 for monitoring fee a year. Is that for each practice or?
For each location, correct.
Okay. And then do you have a command center with you and your administrative staff where all these cameras are being monitored during the day, or you only pull the footage if something happens?
So the nice thing is you have an app on your cell phone that you're able to go between each office location, and you can actually see it in real life, what's happening in each of the offices. And if you need to, you can go and review the security footage as well too. So each of our office supervisors have access to their own location on the Ring app, so that way they can see what's happening in each of their office locations. And then our administrators and myself have access to all the office locations, so that way we are able to see what's happening on a global scale. It's very useful, for example, when you're trying to reach an office and nobody's picking up. So you can go to the security footage and see what they're doing. Are they sitting chatting with each other while the phone is ringing or playing on their cell phones? Why they're not picking up the phone. So from that standpoint, it's also very useful as well.
Did you get any friction from parents or the staff that they're being recorded?
Not at all. We do have signs in the office that the office is being video monitored. For many states, you have to be careful about audio recordings. If you're going to do audio recording, you do have to put notices. So we don't record audio, we just record the video only.
Yeah. Because I'd be a little concerned about patient privacy, right? Although I guess you're the only one, your team's the only one looking at who's coming in and out of the office. I've always laughed because what's so private about a visit for a pediatric office, right? You got strep. It's not like the school doesn't know it, the neighbor doesn't know it, and your parents know it. But I'd be a little concerned. It bothers me when the parents come in and they're on either Zoom or FaceTime, because I think it's a violation of the privacy of the other patients that why should they be on a video sound call with who knows where, when? It's like a locker room. You're not allowed to go to the gym and have a Zoom call in the locker room. That's just not allowed. You have to respect people's privacy. And more I'm seeing something that also bothers me from a confidentiality perspective. These parents that now are remote workers, money that are rostered, especially here in DC, where a lot of employees of the government that don't do much except make your life miserable. They carry their laptops, and every so many minutes they click on a key because there's software on the laptop to see that they're actually doing work. You're not doing work, you're just clicking on a key. You go through the whole physical exam for the kid, and every so often you see them, the computer's open, and they click on a key to log in their hours while they're doing the well child exam. Drives me nuts. I don't know who's on the other end of that computer recording what, and just drives me nuts. And they take Zoom calls in the exam rooms. Drives me nuts. But I guess I'm getting old and these people have different ideas. Any thoughts?
Everywhere you go, you're being monitored. You go to a bank, you're being recorded. You go to a supermarket, you're being recorded. You go to any government office, you're being recorded as well. It's very useful to, as I said, to know what's happening in the office. Are your staff, you cannot be there 24/7. So it's very important to see what the staff is doing. Are the staff working, or are they just doing their homework or sleeping? And we all know that staff behave differently when the manager or supervisor or the owner is there in the office versus when they're not. I find that it's a useful tool to have. And in situations where Sometimes conflict arises where it's your word versus the parent, or you have a parent making a scene in the office, or sometimes when you have to call the police, it's useful to have.
What about in the exam room when you're examining the kid or you're doing your whole interview, your visit, and the parent whips out the phone and they want to record you? Have you ever had that happen?
Yes, and usually if it's not, I'll leave it up to them. I will, in certain situations, allow them to record it. For example, if they have a significant other that wants to participate in the office visit, that's fine. But if they just want to record the video of a procedure, then I would say no. But exam rooms are different. We don't obviously put cameras in the exam room. These are only like hallways, a waiting room, reception area.
I did all this cameras and monitoring and looking and checking. Sounds like back in the USSR.
But again, you're being monitored everywhere you go to. When you go to the airport, when you go to the DMV, when you go to the library. It's important to know, I think with this day and age, you have a trip or fall outside. It's important to know what happened. You have a child tripping in the office. It's important to have that security footage as well.
Yeah.
Obviously, it has its pluses and its minuses, but I find that the pluses much outweigh any of the minuses.
Did you have any employees quit when you implemented this?
Not at all. Not at all.
I wonder, that could be a good thing. People that are just on their cell phone or skimming off the top on cash, they're not allowed while they're watching me now. I'm leaving before they catch me.
Yeah, we installed some video cameras in our Bayshore location, and initially there was some apprehension by the staff, and we just chalked it up to it's for your safety. We want to see what's happening. You guys are working until 10 o'clock at night. You got to see what's happening in the parking lot, what's going on. So we sold it that way. Safety.
Yep.
Yeah.
But also the ability to integrate the camera systems with the alarm and with the electronic door locks. That's a huge feature for us because we know who has access to the office, who doesn't. And also we're able to disable the door codes. Let's say you have an emergency and you need to send a contractor there in the middle of the night for whatever reason. You can just open the door or open the doors remotely. Or you have somebody working on the weekend to do some repairs. You don't need to give them a key to the door. You just unlock the door remotely. When they're done, they close the door and you lock it remotely as well too. So that has been very useful. And I can't tell you how many times we found offices being left completely unlocked because the staff just leaves the office and just doesn't close the door. So we do have periodically one of our staff members check every night to make sure that all the doors are electronically locked and the alarms are on.
Interesting.
When we were preparing for this episode, I found it interesting. You didn't mention a payroll solution.
Oh,
A clock. I think when you have 10 different offices that you're not there physically every day and that many amount of staff, you want one of those that reads your fingerprint to clock in and clock out.
That would be a whole separate, I think, episode by itself. We use something called Bamboo HR, which is like an enterprise level system for payroll and time clocking as well too. So that allows us to really optimize the 150 employees that we have. So that's like a whole.
Yeah, because that's so important. People like forget to clock in and they're like, I worked that day. Or if you're using an electronic timer, they'll clock in and they won't clock out for 3 days. And then you don't know how many hours they work and they want to be paid as if they work 10 hours each day.
Yeah.
Never end of frustration.
What do you manage?
It's location. So we have 9 office locations and then we have a separate call center as well. So basically 10
that's
offices.
a lot.
Yes.
And what do? You got 9 clinics. How do you manage the most expensive inventory in the pediatric practice of vaccines with that many refrigerators and dosages?
Good question, Herb. So we decided early on to invest very heavily on vaccines and vaccine refrigeration and monitoring. So all of our equipment are pharmaceutical grade. And also we realized early on too that if a fridge fails, it takes a long time to get a replacement. So each office has 2 pharmaceutical grade refrigerators. One is, we have one, the big enough that they can basically accommodate. So we use one fridge for private and one fridge for Medicaid. And if one of the fridges fail, the other one is big enough to accommodate both of the inventories. We basically eliminated the situation where if a fridge fails, we have to evacuate all of our vaccines. That has saved us a significant amount of headache, because in the past, if you had a fridge fail, you had to evacuate the vaccines to another office location, and that office would not be able to do any vaccines for a week or two. Basically, that would require us to reschedule a lot of our well visits, because many parents, if you tell them they cannot get vaccines, then they will say, okay, I'll reschedule my physical until you're able to administer vaccines to my child. So that allowed us to eliminate that problem. But also we use thermometers that are Wi-Fi connected. It's very important for us to know what the fridges and the freezers are doing at all times. We use a company called Traceable Life. There are other companies as well too. Traceable Life is a monitoring system that allows you to get notifications, whether it's text or emails, if there are any temperature excursions. All of our supervisors get text message notifications as soon as the fridge or the freezer starts reaching temperatures that are considered not abnormal, but approaching that cutoff. For example, for a freezer, 5 Fahrenheit is considered excursion. We have the monitoring system go off at 1 or 2 Fahrenheit. Usually in situations like that, somebody forgot to close the door. We're able to intervene before we actually have an excursion. But having remote monitoring that's Wi-Fi connected is great, because it allows you to be proactive as opposed to reactive. The last thing you want to do is come in the morning and see that you have an excursion and then have to quarantine all the vaccines and call all the manufacturers. By having remote monitoring and also by having multiple people notified, you are able to intervene before you have an excursion. And also going back to the Ring security monitoring system, one of the features that I like about the system is that it tells me if I have an internet outage, because that Ring monitoring system is hardwired to our network. As soon as there is an internet loss, it sends me a text message notification. You have a loss of internet. If there is a power outage, it will send me a text message. You have a power outage in your system. And then also it will notify me when the internet is restored and when the power is restored. So that's another very important feature of having that system. Because if you have Wi-Fi monitoring, if your Wi-Fi goes down, you're not going to be able to get a notification. If you have a power outage, how are you going to know you have a power outage until you have already a temperature excursion? So having all that information available to you allows you to basically think about, okay, I have a power outage. Let me keep monitoring the situation. If the power doesn't get restored in an hour or two, then somebody needs to go to the office and maybe start evacuating the vaccines before you have an excursion. So it's all about being proactive as opposed to being reactive.
You still have insurance on the inventory, do you? On the private?
Absolutely. There's deductible involved as well. I think ours is $5,000. But again, it's a hassle. If you can prevent the vaccines from spoiling, that is much easier to do than having to file a claim and dealing with the VFC to get the vaccines replaced.
And then as far as the vaccine administration, are you using barcodes right into the EHR or?
We do not. Not at this point.
And why not?
Good question. Just haven't really gotten to it. We enter all the vaccines. The supervisors enter them when they arrive, and staff automatically pull them out, and it's already in our system. I don't know.
I can tell you the answer to that. We have the same system, EHR system. The nurses, they don't want it for some reason. Or it's culture change. We've always done it this way. We tried to implement it twice, and they claim that they tried to scan, it just doesn't work well, and they just revert back to the old way. It's really not that big of a deal. The inventory is there. They take a number and they're done.
Yeah, I'm not sure if that would really optimize the workflow significantly.
The workflow is already pretty optimized in Office Practicum.
Correct. I just think with them scanning a bunch of barcodes, I don't know if it would actually improve the outcome of any measure. I don't know.
Yeah.
What do you feel about it, George?
Again, we tried it twice, like I said, and it just didn't work. We'll try it one more time. The people that swear by it, but I guess those are for more complicated, complex systems. Probably ECW herb is complicated to put the stuff in. Office Practicum is really not that complicated.
Yeah, but do you still have to put the lot number and the expiration date?
The lot number and expiration date is there by the inventory. So if the inventory is empty, it's not there anymore.
Okay.
So basically, they're just picking.
Correct.
Picking.
So somebody needs to enter the vaccines once into the system when they arrive. And then afterwards, each person that administers the vaccine actually pulls the vial, looks at the lot number, expiration date, and then selects from the system that's already entered the lot number and expiration. They're not typing every time the same lot and expiration when they administer the vaccine.
Yeah.
I think in ECW, they are typing every time.
Yeah, no, that's a problem.
The lot number and the expiration date, which, I just from workforce retention.
Yeah,
that's just mind-numbing, stupid work. Nobody likes to do monkey work. It just is mind-numbing.
Yeah.
So that's probably why it's a different workflow in OP. And one of the advantages of having a pediatric designed EMR.
They probably built that with that in mind. They knew what the problems are, so they try to build it and avert the problems.
Yeah.
ECW didn't.
And then what technology do you incorporate to what is the most important, other than your revenue cycle management? I think your phone systems, most important piece.
It's not just phones, it's texting as well too. So before we talk about the phones, I think it's very important in this day and age to have your main number that your patients call to be text enabled. I think patients, the millennials, the Gen Zs all expect texting nowadays. And it's actually very cost effective to have your main number text enabled because it's much easier to respond to multiple text messages at one time than to have a patient on the phone trying to schedule an appointment. I'll give you an example. You have a parent call and says, okay, I would like to schedule an appointment. When would you like to have the appointment? I'd like to have it tomorrow at 2:00. I'm sorry, tomorrow 2:00 is taken. Do you have any other time that's available? Let me look at my calendar. And they go through the calendar, they're waiting, and you're on the phone basically, your hands are tied. A simple scheduling of an appointment can take 5 minutes. With texting, it's much easier. They can send you the information. You can respond to them back. While they're looking through their calendar, you can respond to two or three other text messages. Also, a nice thing about having the number text enabled is that they can send you a picture of an insurance card. They can also send you pictures of rashes or anything else that you need to look at. Very useful feature to have. And it's actually very cheap to have your main number text enabled. Each of our office locations does have that feature turned on. We use a company called Text Request. The only thing is you got to make sure that you're using a HIPAA compliant system, which our system is. But parents love it. And during very busy times of the week when our phones explode, we actually have prompts in our phone queue to say, if you would like to, please text us. We'll be able to respond to you much faster than via phone calls. And it's very popular among our patients.
So is this taken off of your telephone line, or is it a separate app or something?
Your number just becomes text enabled, and there is a website or an app that you can go to and see all the messages that arrive. And you can communicate with the patients 2 ways.
Interesting. That one I didn't know.
And then does it have like a triage or decision tree?
It does not. It's really a two-way communication that, our staff interact with our patients. So our staff in the call center will interact with the patients, our staff in the offices as well too. Now, we don't do any treatments over text messages, but in terms of confirming appointments, that's very popular. Sending recalls, your child is due for a well visit. You can do it through our EMR as well too, but sometimes if you want to do a customized message, is very popular as well too. We can also send a text message link to a patient to pay a balance, request insurance cards. If they need a specialist referral, we can request information about the specialist, all via texting. And it's actually so much faster than dealing with over the phone. And
Correct.
you actually have a record of what exactly transpired. If a mom texted yesterday about an insurance, you can actually pull up that phone number in your app or online and actually see all the previous communications that have occurred, and you can actually address the new issue that arises.
Yeah. I know
It's-
Office Practicum has a text capability, but it's one way. I can text you.
Correct.
And you can text me back. We also use this other product called Freesia, which is like a front-end integration with Office Practicum. They have text messaging capability, and we use it a lot for confirmations, for check-in, for here's a link, I want you to watch this video before the visit. Again, they have to have an appointment for the text to be able to go. So it sounds like yours, I just remember your office number and I text it.
Correct. And we advertise it on our website as well, too. And in fact, we have a widget on our website that is actually connected with text requests. So a patient can go to our website, select which office they usually go to, and start texting directly with our staff from our website. They don't necessarily need to use their phone to do it. They can do it directly from the website as well, too.
Do you have one central phone number that connects all the practices, or does each practice have its own phone number?
Each practice has its own main phone number, which is nice because you want patients to communicate with that specific office location, because otherwise you would be getting hundreds of text messages and you would not know exactly which office they are referring to. So if you have multiple locations, you want to have the main number text enabled. And when you go to text request, there's actually a drop-down menu so you can scroll between each of the office locations.
That was an interesting one.
And even our billing department have their own phone number that is text enabled as well, too. So the billing department can deal with patient questions directly without getting the off-fault.
And it was very interesting. I had another question I forgot, but there's a company called Spruce that does this for medical practices, and some of the newer practices that we consult for are all on Spruce. And Spruce does have the ability to have decision trees. So if you have a question about, like, you want to talk to the nurse about a copy of the vaccine record, that gets routed to one department. If you have a billing question, gets routed to another department. And some of the other practices that we've looked at, they have teams. They're so big that they'll have Dr. Rogu's team. And so there's Dr. Rogu, an extended provider, and the two medical assistants. And that's the team. And if Dr. Rogu is your primary care doctor, and you have a question, you just direct it to their team and they take care of you. I don't know how many clinicians you have in each one of these locations, but it's interesting how people have created teams when they have 5, 10 clinicians in one location so that the patient can get to the people that they're usually contacting.
We also have the portal as well, too. So our EMR has a portal, Office Practicum, that we use as well, too. So if a patient wants to request a medication refill or referral, or they want to schedule an appointment, they can also use our EMR portal as well, too. So we give patients multiple options, and which option they use actually is totally up to them. But the more access we give them and the more convenience we provide, we notice that the happier they are.
Yeah. The only problem with all these little things that go connected, how do you train people?
That is a challenge. So we try to use companies that make the technology easy and simple to use. There's really not a very big learning curve with using any of these technologies.
It's not the use, it's remembering to use. We do this with this, we do that with that, we do that with the other thing.
It's cross-training the staff across multiple platforms. I agree.
Yeah.
It's definitely tricky, but the more technology you provide, I feel also it saves you a lot of time. And also it allows patients to access your office, because the last thing you want to do is not be available to answer patients' questions or be available to schedule patient appointments.
Yeah.
Which
That's a good one.
Yeah. And I don't think that most people under 40 today need any training to how to use WhatsApp or texting.
Yeah.
And I think the 2-year-olds know how to text today.
This episode is sponsored by our friends over at Freed AI Medical Scribes. Let's hear what they have to say. What if you could take the computer out of the physician-patient relationship? With Freed, you can. Freed is the AI medical scribe that listens, transcribes, and crafts perfect SOAP notes for you seamlessly. This isn't just another productivity tool. Freed is a life-altering solution for physicians, helping you regain the joy of practicing medicine. Freed frees you from the burden of documentation, so you can focus on what really matters, your patients. With Freed, the computer is no longer a barrier. It's a quiet assistant that works in the background, capturing every word of your patient interactions, accurately and quickly. The result, you're fully present in each visit, building stronger connections and offering more attentive care. And when the day is done, your notes are too, leaving you with more time to focus on yourself, your family, and your life outside of medicine. Freed is the solution thousands of physicians swear by to reclaim their passion for medicine.
You also use voice over IP and VMAs.
Correct.
What are those and what are the advantages of having that as part of your communication strategy?
We've been using voice over IP now for about 19 years. Originally, we had regular landlines. And the issue with that is that if you're still using regular landlines, is that you're limited by the number of phone calls that can arrive at one time. So some practices would have 5 landlines. And on a busy Monday, if you had 6 phone calls, the 6th phone call would get a busy signal. So some practices would have 10 landlines. Their fees would be astronomical. So early on, about 19 years ago, we decided to go with voice over IP because the nice part about voice over IP is that you have one number, which is the main number of the office. And no matter how many phone calls you get, they'll never get a busy signal. It's impossible to get a busy signal. You can have 1,000 phone calls arrive into your main number. They will never get a busy signal. Also, the nice part about voice over IP is that you can have a phone tree. So as you were talking about earlier, I would like to speak to billing. I would like to schedule an appointment. I need a referral. I need a medication refill. You're able to route the phone calls to the appropriate departments. Also, you're able to utilize voice over IP by giving people specific instructions. We noticed that staff would forget to tell patients, please bring your insurance card. Please bring your copay. If you're a new patient, you need to select this as the PCP. You need to bring in your government ID. You need to bring in your insurance card. By having voice over IP, you're able to have recordings that are customizable for each of the prompts, as opposed to having a staff member remember to tell patients instructions for each particular issue. You're able to have it recorded and automated. For example, for medication refill, before the patient is able to be connected to a live person, it tells them, please have the medication in front of you. Do you know which pharmacy? Do you know who prescribed it last? Do you know the dosage? So that when they're able to reach a live person, they already have that information and the visit can go, and not the visit, but the conversation can be more productive. Also, the nice part of voice over IP is that when a patient finally is able to reach a live, on the caller ID, we know the reason why they are calling. So if I'm a call center representative, on the caller ID of our phones, I'm able to see if it's a new patient wanting an appointment. I can tell if it's an established patient wanting an appointment. I can see the tags that are associated with their phone number that they're calling. I know if it's a doctor calling to speak to a doctor. I know if it's a patient has a general question, or if they have a medication refill, or if they require referral. Our staff are trained to look at those tags, and they're able to address them very efficiently because we have different people assigned to answer those questions. And also, when your phones are completely swamped in the morning on a busy Monday, you're able to do triage. So patients who need an appointment obviously get preference over patients who need a medication refill or patients that require referral. So you're also able to triage your phone calls based on the tags that are associated with a caller ID.
So I presume with your call center, that's where the brain is, and all the 8, 9 practices, they don't really pick up their own phone appointments, right?
The offices do. So
what do you have a call center for?
Good question, because we noticed that many patients prefer to speak to their individual office where they go to. So what happens is that the phones ring first in that particular office for about 20, 30 seconds. If that office is not able to answer that phone call, then it goes into our call center. So the call center acts as a backup for the offices. Now, many times the offices don't have the ability to answer all the phone calls that arrive, but we always give that office the option to pick up the phone calls if they're not busy.
They're never not busy. We got rid of that because found that Mrs. Jones is called for an appointment and she'll, whip out her calendar, stay on 10 minutes to make an appointment, yet Mrs. Johnson is trying to check in or check out. So we got all the phone and all the business out of the offices into the call center. If the call center gets overwhelmed, like at 8 o'clock or 9 o'clock in the morning, then we turn on the offices as a backup to fill up, to pick up those phone calls. The reverse of what you do.
There are certain issues that the office is able to handle better. Like, for example, if a mom is calling to see if her physical forms are completed or not. So again, 20, 30 seconds is not a huge amount of time. We do want to have the offices involved in answering the phone calls. I think it's very important for them to do that. Also, the nice thing about using voice over IP is on a busy Monday, the patients do not need to hold for 20, 30 minutes. They can enter the phone number into the system, and the system will call them when their turn comes in. So it's a pretty sophisticated system because, who wants to be on hold for 20, 30 minutes listening to background music while you're trying to reach someone? So the patients have that ability to leave the phone number. The system will call them. They don't lose their place in line. And also, we don't lose any potential customers as well, too. There are a lot of options for new patients in our areas. There are multiple pediatricians. So if you don't provide them the service, many of them will just hang up and dial the next pediatrician. So by us being able to hold their place in line allows us to not to lose any potential business or even go to urgent care or to the ER. So I think that's very useful. Also, being able to record phone calls is great as well, too. Many times parents will say, they told me so-and-so. They told me to just walk into the office and I'll be able to see them immediately. All our phone calls are being recorded. So we're able to pull up that conversation and see exactly what has transpired. Also, we use recorded phone calls for training purposes as well, too. When we hire a new call center representative, our supervisors are able to silently listen to the phone call conversations between the call center agent and the patient. And if required, they're able to intervene or what they call whisper into the agent's ear without the patient hearing on the other line. So it's very useful for training purposes as well.
Yeah.
One step up from that is you record the call and you have a team meeting once a week and you go over a problem call.
Right.
And then
once again, like back in the USSR. Now,
I don't think so.
Now it's good for training. I agree.
I think if you talk to anybody that's in sales, they record all of their inside sales agents.
Yes.
And see what the conversation was and how they can improve to keep the person looking for a service engaged and bump them up to the right person to close the deal. And when people learn a lot from that. Tell us a little bit more about your VMAs. Why, where are they? When do you use them?
Good. That's a good segment follow-up. With the shortages in the job market, we found it difficult to get people that are highly qualified to answer phone calls. And so I was doing some research online and I said, let's see if there are any companies that offer virtual medical assistant. So I found a company in the Philippines that offers virtual medical assistants, and I was blown away by the level of training that those virtual medical assistants had. Some of them, or most of them that we employ actually are nurses in the Philippines. One is actually licensed in the state of New York as a nurse. The advantages of having virtual medical assistants, the same advantages why a lot of the big companies use assistants in foreign countries as well. If you call Intel, if you call Dell, if you call many of the technical support departments for any of the major companies, they all use support agents in foreign countries. And the level of training and expertise that you get is amazing. And also the financial savings are significant as well, too. Because when you use a virtual medical assistant in a foreign country, the company that we subcontract is in the Philippines. You pay a flat hourly rate, which is, I can say it's $10 an hour. There's no overtime involved. You don't have to pay any disability. There's no insurance. There's no unemployment, nothing. You just basically pay a third-party company the hourly rate and you're done.
Do they have access to your EHR to make appointments?
Of course.
Because I know OP doesn't like overseas connections.
So in the basement of our call center, we have 9 computers that they use to log into. So we use for the staff that work remotely in the Philippines to log into our computers in the US. We have top-of-the-line antivirus and security features on our PCs in the office. And also, we have a system installed on each of the computers that monitors what the employees are doing, which systems, how often during their shift are they accessing our EMR, how often are they accessing text requests for texting, or are they using the voice over IP app to answer phone calls. My biggest concern was, how do I know the staff in Philippines are working? You're not there to monitor what they're doing. So by utilizing a program called Controlio, that gives you a summary each day of what exactly the employee did, which systems they accessed, how much time they spent in each of the systems. And the program is intelligent enough to know if someone is just moving the mouse versus actually doing work.
What is it called?
Controlio.
Controlio.
Yep, controlio.net. So each day I get a report, and my supervisors get a report as well, that tells us what each staff member is doing in our call center. And you can see if they're visiting Amazon for shopping or Expedia for travel, or if they're actually working on the programs and apps that are considered productive for your organization.
Wow. In the USSR.
Well, but
I don't think so. I think that's just really not even part of this conversation. So I think that Igor is an incredibly bright person, and I'm doing this audiobook by one of our colleagues here in Northern Virginia, Tom Meyer, and he talks about data, knowledge, and wisdom. Data is basically a bunch of garbage today because we're producing so many gigabytes, each of us individually, of noise that it's hard to get knowledge out of all of that noise. And the last step is, once you have the knowledge, is using that knowledge to do good and develop wisdom of when that technology can be implemented. And so I see that leadership trait in Igor.
So yeah,
he's gathering data of all sorts in different points to gather some knowledge as to how to be more efficient. And then that gives him the wisdom to really optimize the delivery of care. There are not many people doing this, and it's very impressive, incredibly impressive.
But I'm not the only one who's doing it, because when we interview the virtual medical assistants that we hire, you should have seen some of the companies that those virtual medical assistants have worked. They've worked for major health systems, for hospitals. Some of them have worked for United and Cigna and Aetna. So if those companies can use virtual medical assistants in Philippines to cut their labor costs, which is the biggest expense in any practice, why can't we? Where can you hire a nurse for $10 an hour?
No.
Where can you find a person who has college degree, medical background degree? Some of them nurses, some of them are pharmacists. You have a complete different level of work ethic. You have a complete different level of background. And a lot of them, because of the 12-hour difference, they don't mind working 7, 8, 9, 10-hour shifts. Over there, it's night. So you don't have as many call outs. A lot of the virtual medical assistants are working from their home. And that allows us to really supplement the staff that we have in our call center physically. We have about 12, 13 people physically in our call center, but we also have about 8 people in Philippines. And if tomorrow I need to hire 5 more, I can do that. I don't have as much physical space in our call center to add 10, 20 people. But as our organization expands, if I need to hire more people, I can do that. If I need to hire seasonal workers during the winter, let's say we have a major flu epidemic and I need to hire 5 more people to work for 2-3 months to help with the phone calls, I can do that. So I'm only limited by the amount of space that I have in my basement of our call center as to the number of computers I can fit, and I can probably fit 50 if I had to very easily.
And who
But let's
trains
look at
these
this
people? Who trains these people? In old
company that you hire. So let's
Really?
look at different things. So for example, the can't do mentality versus can't be done mentality that you have, Igor, right? Where do that OP doesn't like it when you have foreign workers. That's an easy solution. The solution of having dummy terminals in your call center that people can log in from anywhere in the world has been around for 20 years.
Yeah.
But it's either you have an can't be done or I can't do philosophy. The second one is the power trade, right? So in Colombia, the minimum wage is $100 a month. Okay. And a dentist makes $1,000 a month. Maybe a good pediatrician makes $3,000 a month. Can you imagine if I could convince pediatricians to log in at 7 o'clock to my office and go over the charts for tomorrow and set them up for me? And I'm paying them good money for living in Colombia, but I couldn't even hire an RN in the US to do that.
It would be below minimum wage.
It would be
In the
below
US.
minimum wage, but they get work, right? My charts are set up. The BMI is in the place it's supposed to be, that there's a reminder this kid's got a strong family history of type 1 diabetes, hasn't had his antibodies drawn, sets it up. And then I just come in, talk to the family, look at the gaps in care I have, and click a button. I'm done and I'm making money. I think that's where we have failed to have imagination and leverage technology to improve care and our own margins. And I see you doing that, and I think it's phenomenal, Igor, phenomenal. Now,
And we're using them also for recalls as well, too, for meeting quality measures. Because yes, you can send automated messages to patients, or your child is due for a well exam, but it's a lot different if you have a live person calling them and saying, hey, your child is due for a well visit, or your child is due for a lead testing. So that's how we utilize our virtual medical assistants as well, too, not only for making appointments and confirmations and answering general questions, but also doing those massive recalls to meet the quality matrix as well, too. We're able to go through recalls of hundreds or even thousands of patients in a matter of a week by having staff in the Philippines go through those spreadsheets and outreach every single patient that needs to be outreached.
And what company is this?
There are many companies for virtual medical assistants. The company that we use is called Portiva.
Portiva. Interesting.
but it's about leadership, Igor, right?
No, totally.
You're trying to remove barriers so that the pediatrician can see the patient, build a relationship, do the best care in that moment, in that exam room, and move on. And you're trying to remove all kinds of barriers to communication, barriers to documentation, barriers to workforce capacity. And you're doing it in very innovative ways that, yes, the Fortune 500 companies do it, but most pediatric offices don't have that leadership.
Yeah, most leaders, what they do is they find a cool technology, they implement it without even looking, and then they say, Dr. Bravo, what's one more click? Just click another button. It's not that big of a deal. Click it. And all these clicks just lead to physician burnout. Now, my My favorite topic, Igor, if you were to pick one piece of technology that helps alleviate and eliminate totally physician burnout, what would it be?
Oh, no. We're going to
Right.
go a separate way. How many times did you have to talk to George, Igor,
We'll get to
about
that story.
the free AI?
Okay.
Tell me how many times.
I spoke to him once, actually, but I think it was
from 3 different times.
Yeah. So one of the issues that every pediatrician faces is no documentation, especially in a busy practice, documenting the notes. Now, most practices have two types of providers that don't document anything, where you see a patient next day, you have to scratch your head and think, what exactly happened? And basically, you have to start from scratch. Or you have providers who like to document everything to the point that either they're running constantly behind or they're spending hours of their own time at the end of the day charting and documenting the notes. So I happened to, I think I saw it on Facebook, the advertisement for free AI, which is basically AI system that documents the notes for you. You're able to use either the app on the phone or you log into their website, and with a microphone, it listens to your conversation that you have with a patient, and then it generates a soap note. And I said, you know what? They had like a 10-patient trial. I said, let me try it. What's the worst that can happen? I brought it into my office. At that time, I just had it on my cell phone. I did 2-3 notes, and I said, oh my God, this is a game changer. I immediately purchased the license for myself. Within a week, I had purchased licenses for all 22 of our providers. Every single one got a license, and I told them, this is not an option. You must use it. If it's a sick visit, you use it. If it's a well visit, you use it. It doesn't matter if it's a complex patient or an easy patient, because you don't know at the beginning of the visit if it's going to be a simple or a complex visit. Many times you have a kid coming in with knee earache, and just as about to leave, mom says, oh, can you refill a medication on my child's eczema? Many providers will just write a refill and that's it, and not even document. If a child has chronic eczema and the eczema is flared up and you refill a medication, that's an exacerbation of a chronic medical issue. With a medication prescription, that's a level 4 visit. So what you would have as a level 3 automatically becomes level 4. So not only is company like Free AI, and there are many companies now that will do the same thing, allows you to have better documentation, but also it allows you to properly bill for all the services that you provide. Because a level 3 visit automatically becomes a level 4, it can easily become a level 5. The system is amazing. It documents all your notes or your visit in a soap note, summarizes it by bullets. And you have a normal conversation like you and I are having right now with a family. There are a few tricks that you have to get used to it. And I think those tricks are very important for good customer care. In the past, we had medical assistants do triage of our patients. We had templates that would open up based on the chief complaint. So let's say if a patient came in with sore throats, the medical assistants would go open our EMR/OP, select sore throat template, and you would already have pre-populated fields of what questions to ask, because we realized that medical assistants are not uniformly great at eliciting a good HPI review of systems. So we created the templates. They still do that. So when I go into the room and open my note and see the history that the medical assistants have gotten for me, I review that with the family. So I'll go into the room and say, okay, Mrs. Smith, I see that Johnny has had sore throat for 4 days and the highest temperature is 102. Is that correct? And mom will say, yes, that's correct, but the fever has been now for 4 days. So you review the history.
The fever was now since the soccer game last week.
Yes.
Johnny scored a goal. What happens with that conversation?
That's
excluded. It does anything that's not medical just gets eliminated. I've tested it over and over again.
Yep.
It gets excluded from the conversation.
But if you correct anything that the medical assistants have written for you, it actually combines the two HPIs together.
Mhm.
And the nice part too is that now when I do a physical exam, I verbalize what I do so that the system can hear my thought process and document the physical exam. And when you do an assessment and plan, it actually it summarizes everything for you. And when you have a patient coming in from a specialist or from a hospital and you have stacks full of labs, you can actually say, okay, I see the CAT scan showed some fluid in the peritoneum. There was WBC was 15,000 with 60% neutrophils. It all puts it into the note. So you're able to process a lot of information and it all gets summarized.
Right.
The technology is amazing. The amount of hours it saved in documentation and charting is phenomenal. And also for follow-ups as well too. Now I can pick up any note of any of our providers. I can look at it and see exactly what has transpired. George, you can elaborate too on your experience.
I could tell you the problems that you have with not the product, with the physicians. Just like me, when you told me about Fleet AI, what did I say to you? I said, I know Office Practicum better than Office Practicum does. I wrote all the templates and I edited them and I created them.
Me too. I did the same thing.
Then I said, and then you said, just try it, George. It's pretty good. And I don't need it. The next day at the meeting, you told me the same thing. Try it. It's good. I said, you know what? I also have medical scribes. I had the medical students from NYIT. They go in and they type for me and they present the case for me. So I really don't need a medical scribe. And then on the third day, what did you say to me? You said, George, do you want to go through life knowing that I knew something that you didn't? So you threw in the competition. I said, all right, I'm going to try it. I was sold after 2. And I called you and I thanked you. Remember? But most physicians will say all those comments, I don't need it. It's just a well visit. How many times does a well visit go sideways? They come in, they fill out the PHQ-9 and they're suicidal. There goes a whole conversation. How many times do they come in? You tell them to take the HPV. I don't want the HPV vaccine in. They come out. I never said that. It looks like you did. And yeah, I think it's brilliant. I've demoed many other AI scribes. This particular one seems to be the best fit for pediatrics because everybody's trying to make more bells and whistles, more complicated. If I can't turn it on and use it, I don't want to drive that car.
And it's affordable. It's $100 a month. And if you purchase a year contract, I think it comes to under $1,000.
Yeah.
You are 20
It's
or 30%.
Best money ever spent. But I still have doctors that will not use it. They have the account. And the best way to get them to use it was I gave them the free account for a little bit, then I took it away. And then they wanted it.
It becomes more enjoyable because in the past, when you had a complicated patient and you were jumping from system to system or illness to illness, I always felt like I had to type while talking to the patient because I was thinking I was going to forget something important. Now it becomes enjoyable. I look at the patient, I talk to them, I can jump between illnesses. I can pull up diagnostic testing that were scanned into the chart. I can review them. And sometimes, when I finish my note and I review it, I'm like, oh my God, I forgot to address something. So then I can go and then I have to call the family back because it totally escaped my mind, what I wanted to tell the family. So it's a very useful tool. And also, I don't know if you use the feature, George, where you can actually email a summary of the note to the patient. How many times you have a dad coming in and saying, can you please write me instructions for my wife? Because I know she's going to ask me all the questions and I'm going to forget. You can just quickly enter the email of that parent and the whole note gets automatically emailed to the parent. So
I agree.
So we have to, Free AI is one of the show's sponsors. I don't think that biases our opinions in any way. There is some great things about Free AI, including that I can have a conversation in Spanish. It translates it into English.
Yes. Or any language for that matter.
They're very helpful. I only speak Spanish and English. So
they do. I did one in Romanian and it worked.
Really? Translated? Okay.
Yep.
So that's a phenomenal feature. It does hallucinate. So if you understand natural language models, it's trying to predict what most people would do with those zeros and ones. that are being put in there. So it does hallucinate. And so if you're in a really busy day and you don't have time to go over each one of the plans, sometimes the plans are really funny, goofy things that they say.
Yeah.
And the other thing is, and this is, it's just, the technology is not perfect, but yesterday I saw at the end of the day, a child with severe eczema, knees, ankles, torso. The kid was doing this and that, and it's okay. Here's your prednisone prescription, some Caflex. Let's come back in a week, see if it's calmed down a little bit, and maybe send you to a dermatologist because it's a Spanish-speaking mom. So I said for an injectable medication. So I'm talking about the monoclonal antibodies that a dermatologist can prescribe, but I can't say I'm going to give your child monoclonal antibody. Yeah, no, parents don't understand that. So the translation of that is some injectable medication, right? Which would be nice if it's they knew that I'm talking about teplizumab. That's the only injectable medication that we use for severe eczema that doesn't respond to normal medication. So it does hallucinate, but it is 100% better. The other thing, it doesn't integrate with ECW or Oral P.
But you have to copy and paste the note.
Copy and paste. So, in ECW, what I do is under the HPI, I copy everything and just click it all at once. I don't split it into physical exam in just one place. And like you said, Igor, when you go back and look at the note, you're like, oh, that's what I was thinking about this kid. Even if I hallucinate a little bit, I'm covering this practice for a week. When Dr. Brian gets back, he goes, oh, Herb was thinking about the teplizumab, the injectable medication, a dermatology referral if a kid didn't get better. Oh, okay, that's simple. You could never do that in a template. You could never do that typing away like crazy, trying to leave that note for Dr. Brian to take a look at when he comes back from vacation. So great. It's a great piece of technology.
And I find that it's a lot easier to delete something than to keep on typing. So I review each of my notes that AI generates. And usually I would say about 95% of the time, I don't have to do anything. But 5% of the time, whether it's because of my accent or because of background noise, it wrote some gibberish there that you have to delete. But I quickly skim through the note and I just delete stuff and just copy and paste it. It's much faster than keep on typing and typing.
Yeah. I think the one other thing that I experienced the other day is with the patient portals, these notes go to the portal right away. You have to be very careful because I used to look at all the notes. Then I started to skim all the notes and then just look briefly at all the notes and copy and paste. And then one day I was really busy and I didn't look at the notes and I pushed it over because I trusted the system. So you can't trust computers. Otherwise you have resident machines. When the mother calls me and saying, you said that the sibling of 4-year-old, blah, 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 had the following thing. And the truth of the matter is there was no sibling.
Yeah.
I must have said something. We would turn it to the student. We didn't turn it off yet. And it picked it up part of this visit. You can't just let it go. You have to review it.
Correct. But the system is still at the early stages. So if we're impressed by what the system is able to do now, imagine in a year or two how more advanced it will be.
Yeah, this is one of the better products out there. I've demoed like about 7, and this always comes back to the best one. Dr. Bravo, I know you got to go and actually be Dr. Rogo and see patients today.
Yes.
I got to see patients.
Thank you guys. Igor, thank you for joining us. And we'll connect again.
Igor,
Absolutely.
this is a phenomenal conversation. Hope to see you in real time in the same place soon.
Thank you, Herb. Thank you, George.
All right. Take care. Happy holidays.
You too. Bye-bye.